Good afternoon. I'm Kira Bailey, Assistant Professor in Psychology and Neuroscience and co-director of the COVID-19 course, along with Dr. Francesca Nestor in Politics and Government. It's my pleasure to welcome you to the 12th lecture in our series. Today we will learn from Dr. Bob Gitter. Dr. Gitter is the Joseph A. Meek Professor of Economics at Ohio Wesleyan. Since 1976, he has taught courses in Principles of Economics, Labor Economics, Public Finance, and Econometrics. Students know him for his rigorous courses, his sense of humor, and his easy approachability, all of which culminated in his winning the Bishop Herbert Welch Meritorious Teaching Award in 1999. His past research has examined diverse topics in economics, including how climate impacts Mexican migration and grant-funded work on the effect of the recession on mental health services in the state of Ohio. He is currently helping analyze a survey of 350 immigrants in rural Ohio and is also looking at how the ability to work from home affected the degree of unemployment caused by the COVID-19 pandemic. As a reminder, you can use the chat function to ask questions throughout the presentation. I will select questions for Dr. Gitter to answer if time permits. You can also continue your discussions on the COVID-19 course Facebook group. And now, 60 to 0 and nothing flat, the impact of COVID on the American economy and the prospects for recovery.
Kira, thank you for those very kind words. I feel very fortunate. I get to touch base with some of my current students, some Ohio Wesleyan students that I haven't had the pleasure of meeting yet, some future Ohio Wesleyan students, some alums, and be sure to drop me an email or send some kind of chat letting me know who you are. I mean, my gosh, students going back so many years. I hope some of my former students are there. And members of the community and friends and other people, it's really a treat and an honor to be able to address you. Growing up in Detroit, we sometimes talk about a car that was very fast. And the idea that a fast car would go from 0 to 60. And doing it quickly, we sometimes used to say going from 0 to 60 and nothing flat. And when I look at what's happened recently, the only thing I can think of, we've gone from 60 to 0 in nothing flat. So, okay, yep. What I want to do today is give you some ideas about what happened. When I look at the programs that are going on right now, what I would really characterize those as CPR for the economy. These are not long-run cures that we're just trying to keep the economy going until we can come up with a vaccine or a treatment for COVID. I want to talk about various models of the road to recovery, what my best guess is as to what it might look like. I also want to share some long-run concerns because of COVID. I do have some. And finally, if time permits, I do want to save time for your questions. I want to talk about long-run changes that will occur. I think there's going to be a different world because of COVID. So what happened? If we look at this, this is a very standard chart in economics. This is the unemployment rate. You hear it on the news all the time. And the unemployment rate, you can see this goes back to about 1980 or so. These shaded areas represent periods of recession. So if you look at the last 50 years or so, you will see that up until recently, the highest unemployment that we saw was about 10.5%. During the Great Recession that we had recently, it hit about 10%. Well, I shared this graph with somebody and they said, I don't see what's going on until they realized that this is not over here the vertical axis. The unemployment rate in April hit 14.7%. Now, one of the things I tell my students, and I'll share this with you, whenever you see numbers, whenever you see a graph, don't memorize the numbers. The question is, what's the takeaway? What's the story that you see? And I would argue here the story is one that has two very important points. The decline in employment, in other words, looking at the unemployment rate, was very rapid and very severe. Unemployment, which grew by about 5%, took over a year to do it. And really, the unemployment rate in February was 3.5%. In March, it was 4.4%. In April, it's 14.7%. So, wow, a large and extremely rapid jump in unemployment. Now, the survey always asks people, actually, that's an error there. The survey was conducted the week of April 19th, and the most recent one, and they asked people about the previous week, so the week of April 12th. My point to you is the most recent data that was released last month was before things got really bad. Point. 14.7%, the unemployment rate, which is the highest in my lifetime, is going to be a lot worse when the next unemployment rate comes out. This was before things got really bad. Now, even though those numbers are bad, they're actually worse. Some employed people weren't working. Now, how could that be? The Department of Labor goes out and they survey people and they ask a question. They say, okay, were you at work last week? If the answer is yes, you're employed. If the answer is no, they say, well, did you have a job? And if you had a job, why didn't you work? Now, normally the question is, did you have a job? Yes. Did you work? No. Why not? I was sick. Okay, you're sick. They say you had a job. You weren't unemployed. You were sick. Or you stayed home to take care of a sick kid. You had a job, but you weren't unemployed. Well, guess what? When this survey went out, there were a lot of people who were saying, I can't come to work because I have a sick child. I can't come to work because I was sick. So actually, the way the numbers are, they're an underestimate of what the true unemployment rate is. Bad, but actually the employment situation is worse. If you look at what happened, what we find out is that the number of people who worked fell by about 25%, but the number of hours that were worked fell by 30%. In other words, some people lost hours. If you were working at a restaurant and you didn't lose your job, great, but you might have found your hours cut. So this was a substantial blow. This sets the stage for what's going on. A lot of people lost their job. Now, the May figures will come out on Friday of this week. The figures for May are released on the first Friday in June, which is coming up in 2 days. So we can speculate whatever. I think there's a real possibility we might see unemployment on the order of 20%. To give you an idea, during the Great Depression, unemployment peaked at 25%. So we are really seeing unemployment at historical peaks. So what's my guess as to what's going to happen when the unemployment rate comes out this Friday? Well, it's kind of like the Roadrunner. I think we're going to see employment continue to fall off a cliff. Now, there's other measures that are really important. One of the things, for those of you who've had the misfortune to have me for Principles of Economics, I emphasize, I say, don't just look at one number, look at a dashboard. If I go to a doctor, the doctor doesn't just say, okay, Gitter, your pulse is 65, or your blood pressure is 120 over 75. They look at a lot of different things. What's my respiration rate? What's my temperature? And just as a doctor wants a dashboard, a number of measures, we want a dashboard. We want to know what's going on in the economy. Employment, it's in terrible shape. What about GDP? This is the measure of everything the economy has produced. Well, the first quarter before the COVID epidemic really hit big, January, February, and March, it was down 1.2%. In other words, and if you 4 quarters in a year, so almost 5% decline. But this quarter, which is not over yet, June has barely started, the best guess is it's going to decline about another 8 to 11%. So at an annual rate, in other words, if this was repeated, that would be a 30 to 40% decline in what our nation produces. If there's any good news, I think we're bottoming out. I think that the layoffs that have occurred, most of them have occurred. I think we've reached probably the bottom. But just to give you an idea, very quickly, we saw GDP fall about 10, 12%. It took the Great Depression, it took about 4 years for it to go 25%. If this continues, we would eclipse the Great Depression, but I think we're leveling off. But once again, the impact was very, rapid. And we're going to come back to that later on when we talk about what are the prospects for recovery. So things happen very quickly. Now, the stock market is not the economy, and the economy is not the stock market. But what you can see is that the Dow Jones Industrial Average, a very, very common measure of the stock market, fell from over 28,000 to about 18,000 and some change. That's a 30% decline. For those of you out there who had 401k retirement plans, you probably now had a 201k. Money was really, people were afraid because all of a sudden they say, wow, my retirement savings have gone down the drain. In some cases, down by a third, down by a half, depending on your investments. Ohio Wesleyan has an endowment. And we suffered losses in the endowment. At one point, Rock was asked the question. He said, yeah, we have suffered losses in our endowment. You invested in the stock market and, it's been a problem. So it's recovered about half of what it's lost. People are, feel that we kind of bottomed out. They're little, they're not quite as pessimistic about the future, but people certainly feel less wealthy than they did in February. Once again, and very rapid. Okay, so what happened? There is nothing that could get the economy back to normal right now. What we need to do is administer CPR. We've got to keep the patient going. These are not long-run cures. All we're trying to do is keep things going until we either A, find an effective treatment, B, find an effective vaccine, or C, find a way to live with this. But all the programs you hear, we're going to talk about them in just a minute. The idea of these programs, I'm not being critical of these programs for this. The idea, these are not cures. These are just trying to keep us going until things change. Excuse me. The stay-at-home orders. Restaurants had to close, and even right now in Ohio, restaurants are operating. They can be outside, and maybe they can open up, I think, to 25% of diners. So restaurants are down. Retail is down. They're limiting the number of customers in the store. Some businesses have had to close. Meat packing. Working in a slaughterhouse, this is a perfect environment for catching COVID. It is cold. People have to shout to be heard. You have to work in close quarters, so the number of people getting infected has been high. Some slaughterhouses packing houses have closed down. That's not COVID, don't worry. Retail has certainly declined. Stores, can't permit as many people. One of the things I've grown to appreciate over time is the importance of business and consumer confidence. If businesses are confident, they invest money, they expand. If consumers are confident, they spend money, and it has plummeted. We have seen a very quick and rapid decline in people's confidence. And if they're not confident, they're not spending money. All we're trying to do now is survive until we can come up with some kind of cure. So this is not going to, what all the programs you've heard about, this is not a cure. It's just, it's CPR to keep us going until we can effect the change. So, what are some of the things that we did? The CARES Act, Corona's Aid, Relief, and Security Act that had various forms. The key is we gave people money. This was great. People were desperate. $1,200 a person, $500 for each kid. It really helped, but we haven't passed anything further. So, for example, one of my sons is married with 2 kids. You can do the math. He and his wife, $2,400, $1,000 for their 2 kids, $3,400 one time only. Does it help? Yes. But unfortunately, he and my daughter-in-law still have their jobs. But my other son lost his. But anyway, this money is just to keep people going. Will it be renewed? Francesca Nestor is there. She could give you a better answer to that than I can. I don't know, but all we're trying to do is get money in people's hands so that they would have enough money to live and also, help the economy. But as this goes on, the money, as you see on the news, has been spent on rent, whatever. We expanded unemployment benefits, something new. One of the growing things in the economy is the so-called gig economy. People working for Uber. Like an old jazz musician used to have a gig, just a temporary shot. The same thing like Uber. They weren't in the past eligible for unemployment insurance. Now, up until the end of this year, they are. And they also increased unemployment benefits. So is this a long-run cure? Absolutely not. But we're trying to get money into people's hands to help them out and also to keep things going until we can come up with a cure or a treatment. You might have heard about the Paycheck Protection Program. Actually, that was part of the CARES bill. It was giving money to small firms, loan forgiveness as long as you spent the money on payroll. These were rushed through, and they tried to make the money available. The banks all of a sudden found they had this money to loan out from the government, but and the money was guaranteed by the government. It was great, but they weren't set up to do it. The lines to the banks, the phone lines were just swamped. People couldn't get the loans. We tried to do it quickly. It didn't work quite as well. The program ran out of money, so they came out with a second round. There's also a problem, you have to spend 3/4 of your money on payroll, but payroll's not always 3/4 of your expense. I was reading about a restaurant owner who said it's 1/4 of his expense. So he gets the money, he has to use it in payroll, but he's losing money because the supplies he needs for the food, that's not covered. And also there were problems, some large firms, I was just seeing an article that several firms listed on stock exchanges, what they call publicly traded companies, were getting money, certainly not small businesses. The government has been lending money to companies affected by the pandemic, to hospitals, state and local governments. Think about your state, wherever you are. Their expenditures are way up and tax revenues are way down. There was a special provision, $60 billion for schools and universities, including Ohio Wesleyan, and the money, part of the money had to go directly to students. And people were given forbearance. They could, in some cases, didn't have to make mortgage payments. So, excuse me, the takeaway is this is desperately needed life support, but it is not a long-run cure. And I don't think there is any long-run cure. I'm not critical of this. It was needed, but this is not, sometimes during a recession, we say the government needs to spend money. This money they needed to spend, but it's not going to cure things. The federal government, I'm not going to get into the weeds here, but they reduced interest rates to as low as they can go. They're letting banks borrow money at 1/4% interest. The problem here is, as I like to tell people, you can lead a horse to water, but you can't make it drink. You can make it easy. You can facilitate banks making loans, but you can't force the bank to make a bad loan. This is separate from the program I talked about before. Here we're making it easy for for banks to make loans, other types of loans, but they might say, we don't think these people will pay us back. We're not going to make those loans. The Fed has done all that it can. Now, I won't get into the weeds, what's called quantitative easing. They're buying all kinds of debt. They're buying mortgages. They're buying business loans. They're buying IOUs from money I lost in a poker game in college. No, but anyway, they're buying all kinds of loans. Excuse me. Sorry about that. The Fed knows their limits. They said, look, we've done all we can. There's nothing more we can do. The government has to step in, cut taxes, spend more money. And we're going to come back to that as well later. So, the way forward. What's going to happen as we go forward? My parents always used to ask me, Bob, look in your crystal ball. What do you see? And my crystal ball is cloudy. I could tell you what would happen. I could make some reasonable predictions if I knew what was going to happen with COVID, but I don't. Will we have a vaccine by the end of this year? I don't know. Will we have one by the middle of next year? I don't know. So if we don't know what's going to happen with COVID, it's hard to predict the economy. But I will share with you some of my best guesses. There are really 4 popular scenarios as to what's going to happen. One of them, the path to recovery, the most optimistic one is called the V. If we look at what happens over time, generally, the gross domestic product grows. COVID is where we have a sharp fall and a sharp recovery. So it's called the V recovery. It looks like a V. Now, I don't think we are going to have a V recovery. The impact on businesses, the impact on people, the impact on confidence, excuse me, I'm not that optimistic. Some people talk about a U recovery. A U recovery, well, it's more gradual. We can see it looks like the letter U. We dip and then we very, very, very slowly recover. I think the two most probable paths are the next two. One is called the swoosh, because what happens is we have a very rapid decline, and what we find out is that we recover very slowly. The path looks like a Nike swoosh. So the idea here is that it will take a long time, maybe 5 years, till we're back where we on the path we were before. There's also the L, and the idea here is we have a permanently depressed growth. COVID does something fundamental to the economy that we never get back to where we are. 5 years out, I don't know. I really don't know. I'm not an epidemiologist. I don't know enough to say, will we find a cure? Will we find a way of treatment, something we can live with? We never found an AIDS vaccine, but we did find a way of living with it. Will we find a way? If the answer is no, then we might be permanently depressed. My best guess is we'll have a swoosh or an L recovery. We won't quickly get back to where we were. Why? There are headwinds. Households' ability and willingness to spend is down. People don't have as much money. And even if they didn't lose their job, even if their money is constant, my wife is retired, I'm still working, my paycheck's coming in. But we're kind of pulling back a little. What's the future going to hold? We don't know. And if consumers are spending less, the economy will be lower, GDP will be lower, what we produce will be lower, and we won't be employing as many people. So I think for a while, hopefully only for a while, not permanently, what we will see is people will be less willing to spend. Some businesses have gone under, and they're not coming back. If a business goes under, well, that's production that's going to be lost in the future. Other businesses aren't going under, but suppose you have a factory. Well, unless you're making face masks, you're probably not investing. So businesses might not be there, and businesses will cut back in investing. I don't think this, I think given this fact, we're not going to have a quick recovery. State and local governments, in general, I think it's 49 of the 50 states have to have a balanced budget. They can't go into debt. So Ohio has a biennium. We have a 2-year budget. So what we're going to find out is that the state of Ohio is going to have to cut spending. There have been massive cuts in Ohio to public higher education. There are going to be cuts to K-12 education. There are going to be cuts to a lot of things. And still, they're probably, we have a rainy day fund, we're probably still going to have to raise taxes. So the result is, if the government cuts spending and raises taxes, this is going to depress the economy for a while as well. We'll get to the federal government in just a minute. There will also be a loss of firm-specific skills. Think about this for a second. I have a friend who worked for many years on what was called a legacy computer system. She was the only one that knew this computer and this computer program that worked for this company. Actually, it was a very large insurance company. So if she would get laid off, she'd say, well, look, I got to get another job. She would go somewhere else, and the firm would lose her. If they had to hire somebody back, that person wouldn't know the ins and outs of the firm. People that were hired It's going to take a while for firms to get back employees, get the right employees, and they're going to hesitate to hire. So for these reasons, I do not see a quick recovery. I don't know enough about COVID to say whether or not it will be a swoosh, where after several years we're back to where we would have been, or whether or not it's going to be an L where we're permanently lower than we would have been. But in my opinion, I don't think you're going to see a quick recovery. But you know what? There's still another problem out there. The federal government, and I would argue correctly so, spent a lot of money. The federal government's budget before all this happened, they were spending about almost $4 trillion a year. And this year they're going to double it with all these programs. This causes the deficit to rise. We had to do it. People needed the money. So the result is, and what you can see here, this is the federal government's deficit, what they owe as a share of GDP, our ability to produce things. So in other words, if it was 100%, what that would mean in English, we'd have to take everything we produced in a year and that would cover the deficit. So it peaked during, right after World War II at about 120% of GDP. And you can see we did a pretty good job of reducing it. But then in the 1980s, we cut taxes, we increased spending. But later on, we brought the deficit down. In recent years, it's gone up. I am not a proponent of the Laffer curve. You can't cut the tax rate and increase revenues. So in recent years, the deficit has gotten larger. And the most recent data that I found, it was about 106%. Well, this year, the government's debt as a share of our ability to produce things was 106%. Well, it's going to go up to about 125% by next year. It's a big jump. Federal government spending is up. Federal tax revenue is down. If you don't work, you're not paying taxes. The deficit, that's 1 year's federal government's deficit. The debt, you add up all the deficits. Debt, all the money the government owes, deficits, just how much they were in the red 1 year. The deficit was going to be on the order of $1 trillion this year. It's past tense, and now it's going to be 3.7. So there's been this jump in the government's debt. It's gone up by 20 percentage points. And this, in the long run, this does concern me. I believe that in good times, last year, times were relatively good. The government should have been not running a deficit of $1 trillion. But we did, and we kept on seeing the debt grow because of these deficits. Because of this, I'm concerned, all this gray here. I'm concerned that such government programs, Medicare and Social Security, there's a good chance in the next 10, 15 years, they won't have the money that they were supposed to have. And these deficits might accelerate that problem. In fact, I think they will. This is worrisome. By the way, if Social Security does go bankrupt, people will still get money from those that are still working. You'll get 80 cents on the dollar. But, we were kind of counting on what it was we were promised. So this is a worry. And if the federal government can't pay its bills, the federal government will have to pay higher interest rates to borrow money. We would be like a junk bond. And this will cause greater deficits each year if the interest rate we have to pay on our debt goes up. So I'm concerned. We did the right thing, in my view, by spending all this money, by giving people breaks. But, economists love to say there's trade-offs. And the trade-off here is we are going to see greater debt. So what are some of the long-run changes we're going to see from COVID? One of the things we're going to see, I think this is going to be, it's not going to be, we're not going to go back totally to the way it was before. There's going to be more working from home. Firms will find out, state government will find out, people can in fact work from home. The good news is you're working from home at 11 o'clock, you want to take a break, play with your daughter, you can do it. You want to go out for a jog at 2 in the afternoon, you can do it. The bad news, I have a feeling when you're working from home, you might get an email at 8 o'clock at night saying, guess what, we have to get working on this report. You'll have greater flexibility, but you'll find yourself on the clock more. But I do think that there will be an increase. It won't be night and day, but I think the percentage of people that can work from home will increase permanently once this is over. There's going to be more use of telemedicine. For those of you that have kids, how many times did your kid have an earache? And you say, oh my God, you drag the kid to the office, they examine it and say, okay, amoxicillin. Well, wouldn't it be nice if you could just, you could hold the kid up to the camera, the doc could look at them, or chicken pox, yep, that's chicken pox, without having to go in. So I think there's going to be increased use of telemedicine. The only thing that really scares me about this is I'm due for my colonoscopy, and the thought of that on telemedicine just scares me. But anyway, I think we're going to see more telemedicine in the future. There's going to be more online buying. People, I think, have found out, wow, this is really convenient. A couple of light bulbs burned out the other day. I think it was on Monday. I said, oh, I can make a trip to the hardware store. Oh, the hell with it. Just got on the computer, ordered them from Amazon. They came today, screwed them in. We find people are getting used to ordering more things online. People that never ordered online before are now ordering it online. I think we're going to see more and more of this. I think COVID will permanently change that. I think we're going to see increased use of automation. If you look at various things, firms are trying to say, well, look, we have to put up shields between workers. Workers might get sick, so they might not be there. Workers, if we have health insurance for them, it's going to be more costly. How can you possibly get around that? Well, automation. And in general, not always, but in general, automation replaces the least skilled workers among us. So when I was a kid, I toured an auto plant, and I saw, the autos being, parts being welded. I saw a paint shop, people with spray guns. Now it's all done by robots. So I think we're going to see more replacement of unskilled workers by automation as firms say, you know what, with the problems of disease and workers, whatever, maybe we want to go in the direction of machines. I think there's going to be austerity, at least for the next few years. There's a loss of confidence. People aren't going to be feeling quite as confident in terms of how much money they want to spend. I think this is going to be a drag on the economy. 5 years from now, will people have forgotten about it? We'll see. But remember, the Great Recession occurred in 2007 and 8, and really it took us to about 2014 to get to where we were before. What's the long-run impact going to be here? Well, I think there's going to be some. So I've really enjoyed, talking with you. Just, a couple of thoughts. I'll be glad to answer any questions you have. I tried to save time, for that. I hope you had some. There'll be some Meet the Professor sessions, students tomorrow, 4 o'clock, all others noon. And you know what? Anybody, you want to send me an email with a question, feel free to do that. But especially if there's some of my former students, some alums out there, I would love to hear from you. And it's one of the things that makes me happiest to hear from alums. And, I wanted to put up a picture of a sunrise to say, you know what? I've seen dark times before. We'll get through this. So it's going to be rough. It's not a happy, optimistic picture, but this is what I see what's happening. Thank you very much.
Thank you so much, Dr. Gitter. That was great. And we have a ton of questions for you. So there's also a very interesting conversation in the chat about at-home colonoscopies. So something to look into, I guess.
Oh, no, you can look into that.
Okay, so our first question has to do with the trillions of dollars that were pumped into the stock market when the decline first started. What did that money pay for, and where did it go, and has it helped?
I'm not clear when they say the trillions of dollars pumped into the stock market, by investors or by the government?
I believe they were referring to the Federal Reserve money that went in.
Okay, the Fed was not pumping, it was not putting any money into the stock market. I'll try to, I don't think the person can clarify, so I'll try and answer this from a few different ways. Some investors were putting money into the stock market. The idea, the old joke is buy low, sell high. When the stock market falls, people, some people will put money into the stock market because things have gone down, but in general, people were selling, which was why things declined. The Federal Reserve was making, was buying loans. So let's say a bank would loan money to Apple. The Federal Reserve would come and they'd say to Apple, we will buy that debt. I mean, one of the things that's important to realize is that debt, a bond, a promise to pay, is negotiable. Those of you out there in the audience know if you have a mortgage can be bought and sold very easily. So the Fed was saying, look, we're going to buy all these so banks have more cash, more liquidity, and banks can make even more loans. So they were doing this to try and pump things up, doing as much as they can. They weren't, the Fed wasn't, putting money into the Fed has not, to my knowledge, bought stocks and, in companies. So I hope with all those different angles, I answered that question.
Yes, I think so. And I'll move on to another question about what do you think the prospects are for something like universal basic income as maybe a replacement for entitlement programs?
Well, I see Francesca's picture there, but it's really more of a political science question than it is an economics question. I'm not sure the country is ready for it yet. Andrew Yang proposed it. It certainly would have merits. The irony is that one of the most conservative economists, Milton Friedman, came up with this idea in the 1950s and said, look, why don't we give everybody a guaranteed basic income instead of welfare programs? But I do know that when I bring this up in class, my students say, no. People would just waste the money. I'm not saying they would. Actually, the government tried a pilot program like that when I was in graduate school, and the University of Wisconsin, where I did my graduate work, was actually evaluating that. The evidence was it didn't cause people to just goof off, but politically, the question you asked me was, what are the prospects for it? Politically, my students said, no way do we want to see this happen. So, it's not never say never, but it's a question of, in the next few years, I don't think you're going to see a universal guaranteed basic income. Just a guess.
So somewhat on similar lines, someone else mentioned that the national deficit was reduced efficiently after World War II because people felt patriotic paying higher taxes. Do you think people will be willing to do that in this case?
Maybe, but I think people might be willing to pay higher taxes, but for a while, people aren't going to have the money to pay higher taxes. My hope would be, Social Security and Medicare, that perhaps we could, increase funding for them. So, boy, the psychology of people in paying taxes, people hate to pay taxes. I don't enjoy it. But my guess would be maybe if there's economic recovery, they might be willing to, to pitch in, but boy, I think it was really more than people being patriotic and willing to pay taxes. I would guess that it was more a strong economy with limited spending was what brought the, the deficit down. But maybe they would be. It's really that one's hard for me to answer.
So how has the limited travel impacted the global economy? We talked a lot about the US economy today, but we have multinational companies. Are they able to continue working remotely, or has the limited travel impacted them disproportionately?
Anybody that's dependent on tourism has been hit terribly. So, for example, cruises can't occur. I mean, they're saying you cannot sail. So if you have, a resort area, it's going to be devastated. I sometimes I have this interest in Mexico, as you mentioned in the introduction. I asked my students, have you ever been to Mexico? And usually 4 or 5 would raise their hand. And I would say, where have you been? And almost all of them say Cancun. I'd say, you haven't been to Mexico. But if you, the tourism in Cancun, a resort area in Mexico, is going to get hit terribly. Travel, restaurants, hotels, people are canceling left and right. So what I would say is industries that are dependent on tourism, airlines, oh my gosh, look up in the sky. You don't see as many contrails because there's not as many planes flying. TSA reports 95% decline, wow, in passengers. So industries that are dependent on tourism, hotels, they're suffering. Countries, in areas and countries that people go to, they have really been hurt. And by the way, we're not the only country impacted by COVID. So the impact that through much of Europe, aside from tourism, has been tremendous, or I mean, it has been great. And if you look at countries in Latin America, and Ecuador, which doesn't have much, I've been there, my daughter was in the Peace Corps there, which doesn't have much of a tourism industry, given all the, the deaths and, that they can't keep up with the bodies in Guayaquil, the largest city in Ecuador, those countries have really been impacted. So industries dependent on tourism have been impacted. Countries dependent on tourism, regions and countries have been impacted. And everything we're seeing in the United States, we're seeing it in many, not all, but many other countries, South Korea, Vietnam, New Zealand, has virtually no cases, but they've also cut off all travel except to Australia. So, it's impacted other countries quite a bit.
All right, so this next one is probably more of a political question, but I know it's one that a lot of people are wondering about. And I also think this is showing very nicely the interconnectedness between politics and economics. But so the question was, why have so many people not yet received unemployment funds? So the filing for those started back in mid-March, I believe, and some people have still not actually received relief.
The system was overwhelmed. That is it, totally. I look at, on my dashboard, one of the things that, I like to look at is each week the new claims for unemployment. Somebody lost their job. This comes out weekly, so it's the quickest, most up-to-date measure we have of the labor market. Up until March, about 200,000 people filed a claim for unemployment each week. During the Great Recession, it peaked at about 700,000 claims. People are always finding jobs, people are always losing jobs. We had a week with in fact, we had more than one, with 4 million people filing claims. So as bad as it was in the Great Recession, we saw almost 6 times as many people filing for unemployment. The system just couldn't keep up with it. I mean, flat out, it was not designed to handle anything like that. And, eventually people will get their money, but if you have bills due today and your landlord's demanding rent or they're going to evict you, that's not, it's not enough of an answer. All I can say is the system was just not designed to handle anything close to that level of claims. Who would have thought it, going back to the first of this year, who would have thought that unemployment claims would be anything like this? Not me.
Yeah, that's a great point. So you had mentioned telemedicine as one of the potential changes that we're going to see more of moving forward. And someone asked if you think that increase in telemedicine could exacerbate or ameliorate the socioeconomic disparities in the medical field. I know that's another big question, but.
I think, if we do it right, I think it could lead to better healthcare outcomes if we do it right. So first of all, we make sure that everybody has access to broadband and everybody has access to a computer. Up until recently, some insurance companies wouldn't pay for telemedicine. So if you're not going to pay for telemedicine, you can't use that as a, as a way of treating people. So, for example, mental health. Well, obviously, we have all these deaths of despair, people dying from suicide, drug overdoses, alcohol problems. I believe mental health treatment could help that. And if you don't allow, if somebody's isolated, if somebody lives in rural Delaware County and they can't get in to see a physician, I think this could be a real boon, but the person has to have, access to broadband internet, and the person has to have a computer that will work. Some areas in Columbus, they've tried to, just as a related point, they've tried to have the kids learn online, and some schools are reporting only 2/3 of their kids have a computer and broadband. Sometimes the kid would have to go to a local Starbucks parking lot just to be able to get broadband to turn in their assignments. So I think it has the potential, if we do it right, to improving healthcare outcomes.
Thank you. And that's a good segue for, or a plug for next Monday, when Dr. Vicki DeLillo and I are going to talk a little bit about the growth in teletherapy. Yeah. So our next question is about, so looking at unemployment, and there are some vacant positions out there, presumably, that maybe some of the unemployed people could fill. What are some of the obstacles to getting unemployed people into new positions?
Well, right now, there's not that many openings. So I'm going to assume that this is more of a general question. The number, up until recently, we found there were more job vacancies than there were people. That is, up until COVID hit. In the last 2 months, that's totally changed. But I think the real problem are skills. People that don't have a high school diploma or only have a high school diploma. I can see on the screen some of my former students from last semester. We read a book where we looked at individuals who had lost their jobs in the automobile industry in Detroit and Canada, and individuals that really didn't have a lot of other skills. If you're 50 years old, if you haven't been in school since high school, if you are not really good with computers, how is this person going to retrain? So it's very difficult for these people. I would hope that we would put better money into training. So training people for the jobs of the future, that's the key. I talk to a lot of people that do training, and they say, it's not just the so-called hard skills, being able to, being able to do plumbing, or being able to do Excel, and or to fix a car, or or take out an appendix. But a lot of times the problem is really the soft skills. How do you teach somebody to show up to work on time? How do you teach somebody how to behave on the job, how to dress, how to not mouth off to the customer? And the people I talk to say, they try, but they don't have good answers. So I guess, what I would say, it's not an information problem to get the people to the jobs. And it's not a problem of all these jobs going unfilled today. It was in January. Today it's different. But in the long run, if we can get people training, I don't know what you do with the 50-year-old worker who has not been in school for a while, but this upcoming generation, what we can do to give them adequate training, both the hard skills, specific skills to doing the job, and the soft skills. I mean, to me, this is what we need to do, and that is very, very hard to impart.
Yes, definitely. So several people have asked why the stock market is showing some recovery, even while businesses like on Main Street are still struggling and consumer confidence is still relatively low.
I think there's a couple of reasons for this. The two main ways that you can invest your money as an individual are to put it in stocks or put it in bonds. The Federal Reserve has driven interest rates on bonds to as low as they can go. So right now, if you're considering buying a 10-year government treasury bond. You're going to loan your money to the federal government for 10 years. They'll pay you something on the order, I think, I haven't checked recently, but I think it's about 1/3% a year. That's nothing. So people are saying, you know, well, what's the other alternative? They want to buy stocks. So they see stocks as a better alternative. That's one reason. I think the other reason would be that we've kind of hit a floor. And with the stock market, you're not looking at what's going on today. You're saying, okay, what's going to happen in the future? So I think people are thinking eventually we're going to, you know, get back on track. There's perhaps some long run optimism, but clearly we're still down about, you know, 12, 15% from the high. They're not quite as optimistic, but we certainly have recovered about half of what we dropped, you know, when things got started. So long run optimism. And where else are you going to put your money? Under the mattress? So I think that's what's going on.
So and I think you talked about this a little bit, but a few people have asked, obviously this isn't the first time the economy has taken a hit and we've had to recover. Are there any particular lessons we could learn from past instances that might be applicable now? Like, is there some things we could be doing that would help recovery?
Not really, because this one is really unique. We have intentionally shut down large parts of the economy, and with good reason. I mean, you know, it would be dangerous to have restaurants open up, bars open up, you know, travel open up, and even if we open them up, you know, you can go out to a restaurant here in Ohio. My wife and I are choosing not to eat inside, you know, at a restaurant. You know, people, there's not much the government is doing what it can to keep the economy going, but there are limits to what they can do because of this unique situation. Lessons, I think the one lesson, you know, that I shared with you, when times are good, the government should not be running large deficits, because when times are bad, this is when you want to run, you know, this is when you have to run a deficit. Government needs to spend money on welfare, needs to stimulate the economy. You know, you want to cut taxes to stimulate the economy when times are bad. When they're good, that's not when you want to be running a deficit. Some of the things we did during the Great Recession, we had the American Recovery and Reconstruction Act. I forget the exact title, but this is where we spent several hundred billion, with a B, $billion to build roads, infrastructure, to try and stimulate the economy. Today, you know, we have needs that right now, June 2020, we have needs. And to get the money out for, you know, let's say we wanted to build you know, a high-speed train between Columbus and Cleveland. You know, this would take years to design, to get people to do it. You know, we don't have, if you will, shovel-ready projects that we could put people on. So some of the things that might have worked in the past just aren't going to work now. So to me, the only lesson is we should have been not running as large deficits when times were good. There's really not much we can learn. I guess the only other thing I would say is give people money so that they're not starving, losing their houses, you know, while, you know, this is going on. Those are the only lessons I can really draw from the past.
Thank you. So my last question, and I wanted to leave you a bit of time to answer this one. So we have a lot of young people here. We have people of various ages. And one of our students asked how you would advise young people and the less young in making wise financial decisions right now.
Well, first of all, college is still going to be a great investment. The ones I fear for at a lot of levels are those people that don't have a college degree. We've seen their incomes decline. At the moment, I'm reading a book by Ann Case and Angus Deaton He's a Nobel laureate, Deaths of Despair, and just talking not about just the economic, but all the other negative impacts in terms of suicides and drug addiction, overdoses, alcohol problems. Education improves your income, your quality of life, the length of your life. We're actually seeing some declines in the lifespan of people without a BA, whites without a BA. In the United States, for whatever reason, minorities without a BA, their lifespan's not declining, but for whites without a BA, it is. And so, stay in school, you'll have a better life. I mean, that would be the first bit of investment advice. Get schooling, develop your skills, do what you can, network like mad. Students at Ohio Wesleyan, talk to career services, get information about, internships, things you can do like that. Once you get out, pay off your loans, save some money. It sounds like, wouldn't it be, great to go out and party and do this, that, and the other thing. Try and, save a little bit of money. And I think that would be the, some of the best things to do. I imagine we have listening some students who will be enrolling in Ohio Wesleyan for the, the first time in the fall. And I'm going to share with them something I share with all my students. What should you major in? Major in something that you really enjoy, that you find stimulating, from professors that you find really, good, stimulating professors. Choose that for your major. You'll find a career. You can get the internships. You'll find something to do. It happens. I think of all my students, Gitter teaches economics. I was just corresponding with one of my former students, an econ major that's a nurse. And I have, former students that are clergy, former students that are elementary teachers. I have former students that are CEOs of Fortune 500 companies, athletic directors, all kinds of things. My advice would be, find out what you really, enjoy studying, and find a department where you like those people and do that. And you know what? Things will take care of themselves. Save a little bit of money. You'll be fine in the long run. And okay, if you want an investment tip, buy low-cost mutual funds, put the money in that, never take it out until it's time to retire. Write me an email 40 years from now and thank me for that advice. Served me well.
Thank you so much, Dr. Gitter, for sharing your time and knowledge with us. And thank you to everyone who joined us and asked these excellent questions. Don't forget that you can continue your conversations on the Facebook group. And another way to continue the conversations is in the Meet the Professor sessions. Students who have registered for course credit can join us tomorrow at 4 p.m. in Blackboard Collaborate. And community members can join us at noon on Friday in Blackboard Collaborate. The RSVP links will be sent via email, and if you have any questions, please contact COVID Course Coordinator at owu.edu.